All right, so the autonomic nervous system then is part of that involuntary, homeostatic, negative feedback control system that is essential to life. So when we look at what are the effector cells, which means what do these neurons stimulate? They stimulate smooth muscle, cardiac muscle, and glands. So make sure you highlight that and really pay attention to those three special parts in the body that are under control without our awareness. It's the autonomic nervous system. So smooth muscle we find in the digestive tract, in the airways, in the iris of the eye, in the urinary tract, the reproductive tract. Cardiac muscles in the heart, and glands are all those glands, whether they're exocrine or endocrine. So an exocrine gland would be like a salivary gland or a lacrimal gland that produces tears. Endocrine gland is everything else, right? Your pancreas, adrenal cortex, all that. That's all controlled by special neurons that we call autonomic motor neurons. And there are two types of autonomic neurons. There's parasympathetic and sympathetic, depending on what we want to do with this body that's in a state of either relaxation or stress. So looking at the two divisions, so this is kind of putting it all together. It's part of the peripheral nervous system. So in our nerves coming off of our spinal cord are the outgoing information, the motor neurons, and those could be serving voluntary skeletal muscle, that we call them somatic motor neurons. And if it's serving cardiac muscle, smooth muscle, and glands, that's the autonomic motor neurons. And again, sympathetic means stress response. Anytime we need to raise the heart rate, dilate the airways for better breathing, dilate the pupil for better vision, then we're going to stimulate those sympathetic motor neurons, autonomic motor neurons. So sympathetic is stress. So think of, there's 3 S's in the word stress, and sympathetic starts with an S. Parasympathetic, para kind of means like alongside or next to. So parasympathetic is the rest and digest. So that's what we want to be in most of the time, right? We don't want to be in a state of stress. That's hard on the body over time. Higher heart rate, higher blood pressure. We don't want that. We want parasympathetic. We want rest and digest, where you're sitting, you're relaxing, you've got a nice heart rate, your smooth muscle in your digestive tract is moving food through, you're not feeling sick, you're not constipated, you don't have diarrhea, everything's great. So that's the parasympathetic, the rest and digest system. We also call it the wet system. It promotes secretion, so watery saliva, good tear production, enzyme and digestive enzymes, and movement in the digestive tract, bowel activity. That's all produced within the parasympathetic nervous system and keeps us moving things through the body. So again, the effectors, somatic is skeletal muscle, voluntary, other than the diaphragm. The diaphragm is the only skeletal muscle that's not voluntary. That's for breathing. And then the autonomic are those cardiac muscle, smooth muscle, and glands. So when you look at the neurons that come off the spinal cord, whether it's parasympathetic or sympathetic, they're a little bit different. See the purple neurons coming off the central nervous system? That's the parasympathetic neurons. They come off the spinal cord at the base of the brain. So that's the cranial. Remember the cranial nerves we studied in lab? So the cranial nerves that serve the eye are the oculomotor and optic neurons, right? Optic nerve. The salivary glands, remember which one was in charge of salivation? Trigeminal. And then the vagus nerve, look at the bottom one here that goes to the heart. So here, this one, cranial nerve number 10, goes to the heart, lungs, everything here. All those parts for digestion and well-being, that's the vagus nerve, cranial nerve number 10. So when you think of vagus nerve, you're thinking parasympathetic nervous system. When we stimulate the vagus nerve, we slow the heart rate, promote digestion, constrict the eyes, the pupil of the eyes, because we don't need to have good vision when we're just relaxing. And that can be dangerous when we stimulate the vagus nerve by coughing or bearing down, as in a bowel movement. And that's good if we're bearing down to have a bowel movement, because the parasympathetic nervous system is in charge of that. So that's a natural response. And it's funny, after raising 6 children and sitting in many stalls or many bathrooms while my toddlers were potty training and I see them bearing down to have a bowel movement, I'll see their eyes fill up with water. And that's the parasympathetic nervous system. Remember I said it's the wet system? It causes tearing at the same time as contraction of the lower intestine and that bearing down response. It's a natural response. So that's the vagus nerve. And if a person is bearing down because of constipation on the toilet, but they already have a really low heart rate due to aging and maybe some cardiac dysfunction, that's very dangerous, right? They could pass out. They could have such a low pressure from bearing down that they could pass out. So we have to be careful in the nursing homes and the hospitals that our patients aren't getting constipated and bearing down and getting dangerously low heart rates. But the other part, the good part, is if someone's had too much caffeine or having an anxiety attack and their heart clicks into this high rhythm, or you have a patient with atrial fibrillation or VTAC, heaven forbid, what we can ask them to do is cough or bear down if they're able to do that, and that will lower the heart rate naturally. It's called the vagal response or the vasovagal response, or the Valsalva maneuver is another name for it. It all starts with a V, right? Because what nerve are we trying to stimulate? A vagus nerve, and that's part of the parasympathetic nervous system. The rest of the neurons for the parasympathetic nervous system come off the lower part of the central nervous system, the sacral region of the spinal cord. So the parasympathetic nervous system is called the craniosacral system because it comes off the brain. So a lot of the neurons come off the cranium, the brain. They're cranial nerves. And then the lower part. So the bladder and the genitals are the sacral region of the spinal cord. So sometimes when we look at pain that's coming from, say, certain organs, if we look at how it enters into the spinal cord, it shares pathways with somatic sensory neurons and makes us feel like, oh, my left shoulder really hurts. When actually it's the heart that's having pain because of lactic acid metabolism due to low oxygen, due to narrowed vessels or a blood clot. So referred pain can mean lots of different things. Like a person can have right shoulder pain and it's actually coming from the gallbladder. Or heart, we know, can be in the left jaw, up the neck. Some people even complain of an earache when they're having a heart attack. And then down the left arm. And they can feel numbness and tingling in their fingertips too. So that's called referred pain. It's just because these neurons, these sensory neurons, are coming in from organs and from skeletal muscle, and these dermatomes sharing the same pathway to the spinal cord. So the sympathetic nervous system, if we look and see where these neurons come off, it's all in the thoracic and lumbar region of the spinal cord. So this is the thoracolumbar division, we call it, because all those neurons come off in this region of the spinal cord. So if you think about, spinal cord damage, if we have spinal cord damage in T1L1, is that going to affect parasympathetic activity? No. It's not, because those neurons are not running through that area. Now, sensory neurons, yes, it'll affect sensation going up to the spinal cord, but as far as that response, that is in the craniosacral division. So people can sometimes have impaired sympathetic or parasympathetic activity depending on where the spinal cord damage is. Okay, so neurotransmitters, these are things that are released by these motor neurons. We know that all parasympathetic postganglionic axons, so the axon that's going to feed the organ, they all release acetylcholine. And sympathetic postganglionic neurons release norepinephrine. So when you think of the rest and digest neurotransmitter, it's acetylcholine. The stress neurotransmitter is norepinephrine. Another name for norepinephrine is adrenaline, right? So adrenaline, that's why we call the neurons that release norepinephrine, we call them adrenergic, which stands for adrenaline-releasing neurons. And cholinergic fibers are acetylcholine-releasing neurons. So that's where that name cholinergic and adrenergic comes from. So you have a copy of this to look at. It's on page 533 in your textbook. It's a great summary of the 3 different types of motor neurons we see in our nerves. So here is the sympathetic neurons. So they release acetylcholine. The first neuron releases acetylcholine. The second one that actually stimulates the organ releases norepinephrine. We also have neurons that synapse on the adrenal medulla, because that's where norepinephrine comes from as an accessory endocrine organ. Not accessory, but I mean accessory norepinephrine. So we have 2 sources of norepinephrine directly from these adrenergic neurons and also from the adrenal medulla. And then it enters the blood. So epinephrine goes everywhere. So when a person has a stressful experience, whether someone just startled you or you were suddenly told you had a quiz today and you weren't prepared, and all of a sudden you get a stress response, it takes a while for that stress to go away because you have norepinephrine from the adrenal medulla everywhere in your bloodstream. All cells are impacted by that. Where if we look at the parasympathetic neurons, there is no bloodstream entrance of the neurotransmitter. We have just localized release of neurotransmitter on that specific organ. So acetylcholine from a parasympathetic neuron is going to have the rest and digest effect. So that means we're slowing the heart rate, we're improving blood flow to the digestive tract, we're increasing enzyme secretion in the digestive tract, because that's all rest and digest activities. So we have receptors on organs for either acetylcholine or norepinephrine, depending on what the response is. So if we look at, for example, this is a parasympathetic neuron going to organs. There's receptors for acetylcholine, and what's it going to do to that organ? What effects will we get if that organ binds acetylcholine? Which system releases acetylcholine, did we say? Parasympathetic or sympathetic? Parasympathetic. So what type of effects will I get on those organs? Rest and digest. Yep, rest and digest effects. And if it binds norepinephrine, fight or flight or stress response, right? So the type of receptors, we have different receptors. We have nicotinic and muscarinic receptors that bind acetylcholine. The difference between these two is nicotinic receptors are excited by acetylcholine, which means that neuron is, or that organ is stimulated when acetylcholine binds. And muscarinic means it's inhibited. So muscarinic receptors are those receptors on our organs that when they bind acetylcholine, we get rest and digest effects. So when you think muscarinic, you're thinking rest and digest. Those receptors impart a rest and digest effect. Nicotinic would be found on skeletal muscle cells, wouldn't they? Because when acetylcholine binds to skeletal muscle, what does the muscle do? The skeletal muscle, it contracts. Remember the neuromuscular junction? So skeletal muscle, part of the somatic nervous system, is always stimulated by acetylcholine. But when we're in the autonomic nervous system, the effector cells, smooth muscle, cardiac muscle, and glands, they're always inhibited by acetylcholine. So the receptors are different. Nicotinic receptors bind acetylcholine and are stimulated. And we find those on our skeletal muscle cells. So if we go back to this diagram from your book, the receptors here are nicotinic because this neuron is stimulated by acetylcholine. The same thing here. There's 2 neurons in series in all of our autonomic neurons. So this one, the receptors on the adrenal medulla would be nicotinic because acetylcholine is released, stimulating release of epinephrine. And the receptors on this neuron here would be nicotinic because they're stimulated by acetylcholine. And would you agree that all preganglionic neurons release acetylcholine? If you look at this diagram. Okay. The only difference is when we get to the postganglionic neuron. So here is for sympathetic. This is the postganglionic. Here's for the parasympathetic. These release norepinephrine, the sympathetic. The parasympathetic releases acetylcholine, and these are the ones, these effector cells are the ones that are going to have the muscarinic receptors, which means they'll be slowed down by acetylcholine. And these would have a number of different adrenergic receptors. And there's a couple of different types. So nicotinic, muscarinic, they all bind acetylcholine. Nicotinic is stimulated, muscarinic receptors are inhibited. It inhibits that organ. So look at all these lovely adrenergic receptors we have. So beta 1 and beta 2. Beta 1 we find on the heart, and that binds norepinephrine, and what will it do to the heart? If we want to stress out the heart, what do we do? Increases the heart rate. What does it do to the force of contraction on the muscle cell, do you think? Stronger. We want the heart to beat faster and stronger. So when beta 1 receptors on the heart bind norepinephrine, they are contracting stronger, and the heart rate, the SA node, is firing more rapidly. Beta 2 is found in the lungs and also on some other organs as well. But to distinguish between beta 1 and beta 2 in terms of dilation of the airways, we have one heart, so beta 1. We have how many lungs? 2, beta 2. So just think of them that way. Beta 2 is, a big one for the lungs, but again, it's found other places, but just focus on the lungs for our purposes. When you get into nursing school, that's where we focus on beta 2 receptors as well, as those are the ones in the lungs. Beta 1 is on the heart. So beta 1 and beta 2, again, this whole list I'm showing you here, beta 1, beta 2, beta 3, alpha 1, alpha 2, those are all Greek symbols. They're all norepinephrine binding receptors. So they all produce sympathetic effects. Okay, these are all sympathetic effects on the organs. Again, what do we call the receptors that are parasympathetic? There's just one name for all of the receptors. What did we say in the previous table? All the receptors that have parasympathetic effects? Muscarinic. Yep, muscarinic. So if I look at the heart, it's got beta 1 receptors and it has muscarinic receptors waiting for which neurotransmitter is going to be in higher quantity. So if I'm stressed out, which receptors are going to bind more neurotransmitter on the heart? Beta 1. Beta 1. So I'm going to have a predominantly fast heart rate, strong force of contraction. Then when I tell myself, I got to relax, quit stressing out, and I do a little negative feedback, then which neurotransmitter will be dominating? Which neurotransmitter? There's two choices, acetylcholine or norepinephrine. Acetylcholine. And which receptor binds acetylcholine on the heart? What did we just say? All receptors that bind acetylcholine and give us parasympathetic effects? Muscarinic. Very good. Okay, so most of our organs have receptors for both parasympathetic and sympathetic neurons. So they can bind either acetylcholine or norepinephrine depending on which is dominating, right? Which is being released more, which is being stimulated more. So dual innervation means both neurons stimulate the same organ, but it depends which is dominating of what the effects are. So if the sympathetic is dominating, we're going to see increased heart rate, respiratory rate, less digestion and elimination, right? No urination, no bowel movements if sympathetic is dominating, because that's not the rest and digest. And with the parasympathetic, we're going to see lower heart rates, lower respiratory rates, but digestion and elimination will be improved if parasympathetic neurons are dominating. But we need a little bit of both to be present in a resting state. We have something called sympathetic tone. Our blood vessels have alpha receptors on them. There is no parasympathetic stimulation to blood vessels. So we always have a little bit of sympathetic stimulation to our blood vessels, even in a rest and digest state. And that's important. We need some constriction of our blood vessels. Otherwise, what would happen to blood pressure? It would drop and be in the tank, and we would pass out and not get oxygen to our organs. So we have some sympathetic tone that keeps our blood vessels a little bit constricted, maintains blood pressure. So number one here, underline or highlight, is blood pressure. Without sympathetic tone, we'd have no blood pressure. So some drugs will block those alpha receptors and help to dilate the blood vessels. Some people have too much constriction because of stress and because of narrowing arteries due to cholesterol. So we need to open those up by giving drugs that block the alpha receptors so they can't bind norepinephrine and we don't get as much sympathetic tone. So a lot of the medicines you give are binding or blocking or mimicking these receptors, and we're either enhancing the effects or preventing the effects of parasympathetic or sympathetic nervous system activity. So parasympathetic tone, we need a little bit of that all the time, because do we want no smooth muscle contraction while we're going about our daily business? Like even if you're a little stressed out, do we want no movement of food through our digestive tract? No way, we gotta keep things moving. So we always have a little bit of parasympathetic tone to keep things moving through the digestive tract, to keep our urine going through to the bladder, right? And giving us sensations that we need to urinate. So we do need constant parasympathetic stimulation, even in a stress state. And it also slows the heart rate down, because this SA node wants to fire every 100 times in a minute. But that's not our resting heart rate. Our resting heart rate is what number? The average resting heart rate, like according to a textbook, is 75 is average. 60 to 100 is normal, but 75 is average. So normally it would be 100, but because of constant parasympathetic tone to that SA node, it comes down to 75. So that puts less stress on the heart to have a little parasympathetic tone, and again, keeps our food and urine moving through. But again, if we want to promote urination, we want to give drugs that, let's see, I'm trying to read this correctly now. Drugs that block parasympathetic, increase heart rate, and block fecal and urinary retention. Block retention. That's kind of a bad, that's not phrased well at all. We could erase or cross that last part of that last half of that sentence and say they increase, so drugs that block parasympathetic responses increase heart rate and promote fecal and urinary retention, right? If we're blocking the rest and digest, we're going to we're going to promote fecal and urinary retention. So you should cross out the word block and say promote, because you're blocking the parasympathetic response. So this would cross out this block and write promote. And who would want that? Someone with incontinence, right? If a person struggles with fecal incontinence and they have to work, and do a specific job, they want to hold that back, right? Or women that have leakage, they want to take something that blocks that parasympathetic response and prevents urination. Now, we wouldn't want to give that with someone who has an enlarged prostate or constipation, right? That would be devastating. So parasympathetic tone is something we need to have movement of our digestive tract. Cooperative effects means sometimes these two systems cooperate to accomplish a certain task. For example, ejaculation in the male is necessary for reproduction. In order to achieve ejaculation, the penis needs to become erect for insertion into the female. So erection and arousal is caused by parasympathetic fibers dominating. So that causes dilation of the blood vessels serving the penis so it can fill with blood and become erect. And then after a certain amount of arousal is achieved, the body switches to sympathetic domination, and that causes ejaculation and release of semen. And contraction in the female as well when she achieves orgasm. That's sympathetic domination. And what does orgasm look like in the body? Increased heart rate, dilated airways, and dilated pupils. That's the sympathetic response. Again, now you have norepinephrine flooding the bloodstream after orgasm. Can a male achieve erection shortly after orgasm? What has to be dominating for the male to achieve erection again? Parasympathetic. With all this norepinephrine floating around, what receptors are bound? All the sympathetic receptors, right? So it's impossible, like in the movies, you know, that, oh, they did it all night long. Well, there is a period, it's called a refractory period, where the male cannot achieve erection again because of the sympathetic domination from the previous orgasm is still in the system. It takes a while for that to break down and start over, reset. So that leads into this slide. Sympathetic division is long-lasting body-wide effects because norepinephrine is released from the adrenal medulla into the blood. So it's everywhere. Where parasympathetic neurons are localized. It's that neurotransmitter is released just to that organ that's being stimulated. So it's not everywhere. So it doesn't take as long to break down in the synapse when, I mean, that's quicker versus norepinephrine everywhere in the bloodstream. So it's inactivated because it's released into the blood until it's destroyed by the liver. So norepinephrine is released in the blood and must be metabolized by the liver. So it lasts longer. So then if you have a patient who's stressed out and upset, or maybe just stressed out going to the bathroom and back because they're in a lot of pain, they just had bypass surgery, we want to sit down and say, oh, I forgot to take your blood pressure. Let's get that real quick. Do you want to get blood pressure right after being in a lot of pain and walking to the bathroom? No. You want to get blood pressure before they get up. And sometimes it's an emergency and you can't, but I'll do that with my patients quite a bit. I'll say, oh, I need to get your blood pressure. Like I'll come in and I'll say, oh, I'm glad you're here. I need to use the restroom. And I'll say, well, is it an emergency or can I grab your blood pressure quick before we get you moving? Oh, that'd be fine. That's the time to do it, before they get up rather than after. Unless you want to hang out in the room and chat for half an hour. A lot of us don't have that kind of time, right? Okay, so what controls these neurons, parasympathetic and sympathetic, which needs to dominate at the moment? It's the hypothalamus. So depending on the state of the body, just like in the endocrine system, remember the hypothalamus was boss of the endocrine system? It also controls these autonomic motor neurons. But the good part is we can also override that. The cerebral cortex is the thinking brain, and that can override that. Just like biofeedback, negative feedback that people can give to themselves. We can lower our heart rate by just thinking about it. And we can also raise our heart rate by thinking about stressful things, right? So we can override natural hypothalamic control by our own, thoughts. But the limbic system is kind of our subconscious brain that also drives the hypothalamus. So there's different parts of the brain that make up the limbic system. It's our emotional brain. It's where we get cravings from and keeps us from going hungry, but also gives inappropriate cravings sometimes. So again, the cerebral cortex can override the limbic system, but they all have control over the hypothalamus. So here we can see hypothalamus is boss of the autonomic nervous system, but it receives feedback from the limbic system, our emotional brain, and then the cerebral cortex, our thinking brain. So when you think about the hypothalamus, it's in charge of not only, just rest and digest, but body temperature, water balance, with the endocrine system, we already talked about that. Some of our emotional stages that we can kind of hang out in. If you're an angry type, that is sometimes at the level of the hypothalamus. We inherit some of those patterns of behavior, but also it's influenced by the environment. And some of our phobias that some people develop can be at the level of the hypothalamus based on the inability to override some of those fears and phobias. As we age, what do we get to look forward to? As young people, it's usually some type of damage to the neurons or to the brain that causes people to have inappropriate autonomic responses. But as we age, that response, that release of neurotransmitters from that first neuron diminishes with age. So as a result, we have less parasympathetic effects on the eyes and the digestive tract. So constipation, dry eyes, frequent eye infections, drier mouths, less saliva, less mucus secretion in the digestive tract, promoting cancers and ulcers and stomach issues. And then orthostatic hypotension. When we stand up, our blood vessels don't constrict to maintain that sympathetic tone very well, and people end up passing out So it's an issue with aging is the inability to adjust our blood pressure with body position. So what do you tell your patients to do then when they're getting from a laying position up to the walker to the bathroom? Do it slowly. Sit for a minute, stand for a minute, ask them how you're feeling dizzy at all, and then walk if they feel okay.